Hello, it's John Coombs. I'm the Wellbeing Specialist at Global Health Clinic. Part of the role I play here is to do some initial assessments on wellbeing, and then I refer people on to the specialists that work in other fields. Now, one of the things about wellbeing that makes it slightly different to our traditional understanding of health is it incorporates a whole lot of different facets or pillars of wellbeing. And one of the ways we do this is we have a pie chart here of 7 major issues. And what those are is diet and nutrition, rest and relaxation, social connection, self-expression, using your intellect or your mind well, spirituality, and exercise. Now, if we incorporate all these things as part of a main frame, they all have an equal status. Whereas in most cases, a health professional will think that the diet and nutrition is the biggest part, or the psychologist will think the mental management is the biggest part, or the exercise practitioner will think that that's the biggest part. From our perspective, to have proper holistic well-being, all of them need to be in some form of balance, and all of them need to have a focus and some attention placed onto them, some time put into them, and if need be, some proper coaching or mentoring or therapy to help bring about your ability to manage that side of things, like for example using your intellect. Very few people are properly trained to use their intellect. They might be well educated, but they haven't been trained to use their intellect to bring about the best well-being outcomes in their life. People in many cases have traditionally come from a religion, and the religions were all about well-being. They all preached very, very important information about forgiveness and gratitude and love, which are all extremely good for our well-being, and they all have scientific validity that our cells respond particularly well, our DNA responds well to love, gratitude and forgiveness. So this is scientific. This is not religious, this is scientific. And in the spectrum of spirituality, yoga or qigong are basically saying the same thing. So Jesus and Buddha and a yogi will be saying exactly the same thing about well-being. You don't have to be part of religion, but you do have to understand the science behind these issues. Now, most of the issues that we deal with in our life are unseen to us. They don't relate to our senses. And so on certain levels we have modern terms now like quantum or emotional or mental or spiritual, each of which has a significant role to play in our health and well-being. But they're not the sort of thing you get from a medical practitioner. They're not the sort of thing you'll get from many of the people that are responsible for health management these days. But modern science, and especially quantum physics and quantum biology and energy psychology and epigenetics, which are all very significant scientific aspects of modern society, have all gravitated towards these aspects of well-being. And all the new modalities that at Global Health we have put a lot of effort into understanding how these new modalities work, how people have gone and trained in them and educated themselves on brand new modalities, and we're able to bring them to you in an integrated fashion. So aspects of wellbeing, as I mentioned, are the integration of those 7 primary pillars, all of which have equal and significant status, but in many cases people neglect 2, 3 or even 4 of them and think, well, all I've got to do is do my diet and do my exercise. But in the process, neglect relationships and neglect the quality of the employment you're involved with, neglect real deep issues that mean a lot to you, but you put them in the background thinking your job's more important than that, or your financial status is more important than that. And in the process of that, your well-being will deteriorate because you've neglected very, very important intrinsic aspects to well-being and the holistic aspect of well-being. So please have a deeper look at our website. There's a lot of information there. Everything we do is science-based. It's validated by universities like Harvard University, Stanford University, Cambridge University. We look very closely at what NASA does to help keep astronauts healthy. We're constantly searching for modern and more effective and more cost-effective ways of helping you. But the focus, as I say, is this integrated well-being or this holistic well-being. Look forward to helping you. Thank you very much.